So to build my joint, I used this elastic bandage for the muscles. I used orange balloons for the ligaments and the tendon. I used a wrapped chocolate inside of the balloon, a flat one as the patella, and then this is like the bursa, the subcutaneous prepatellar bursa. And then I used a sock to form the tibial plateau, and I used a cut up sword as the meniscus. I used cardboard tubes from paper towel and Christmas wrapping paper for the bones, and I used double-sided tape for all the attachments, and I used Christmas ornaments to form the condyles and more of the plastic sword to form the epicondyles. Okay, so the knee has two joints, and the first one is the patellofemoral joint, and it is a gliding joint. So it's between the patella and the femur, the intercondylar groove. So the patella will move up and down the intercondylar groove when the knee is flexed. That. And then extended. And then next we have the tibiofemoral joint, which is between the tibia and the fibula, and it is a hinge joint, so its only movements permitted are flexion and extension. Just to show the movements a little better, here is my joint flexing and then extending. Now we have the muscles, and right here is the rectus femoris, and it originates on the anterior inferior iliac spine, which is not on the model, and its insertion point is the tibial tuberosity right here, and it goes through the patellar ligament. Its action is to flex the hip and it extends the knee. It's innervated by the femoral nerve, which all three of these quadricep muscles are going to be. So next we have the vastus medialis right here, and its origin is the medial shaft of the femur, and its insertion point is also the tibial tuberosity via the patellar ligament, and it functions to extend the knee. And its innervation is also the femoral nerve, same with the vastus lateralis right here, and its origin is the lateral side of the shaft, and its insertion point is also the tibial tuberosity via the patellar ligament, and it functions to also extend the knee, and its innervation is also the femoral nerve. The posterior side of the knee, we have the semitendinosus muscle right here, and its origin is the ischiotuberosity, which is also not on the model, and its insertion point is the proximal media tibia right here, and its action is to flex the knee, and it extends the hip, and its innervation is the sciatic nerve. And then underneath it, a little shorter, we have the semimembranosus, and its origin is also the ischiotuberosity, which isn't on the model, and its insertion point is the medial condyle of the tibia, and its action is also to flex the knee and extends the hip, and its innervation is also the sciatic nerve. So I've taken the muscles off to explain the ligaments and the tendon more. So the tendon would attach to all four quadriceps muscles, and it would attach it to the top of the patella, and then the patellar ligament right here attaches to the apex of the patella and then attaches here on the tibial tuberosity, and they both help to extend the knee. Okay, so on the anterior of the knee you can see the transverse ligament, which runs across the menisci and reduces pressure that is exerted on it, and the coronary ligament right here attaches the medial meniscus to the anterior tibia. Okay, so now on the medial side, we have the medial collateral ligament, or the tibial collateral ligament, which attaches from the medial femoral condyle to the medial tibia below the plateau, and this resists valgus forces throughout the knee. And then on the lateral side, we have the lateral collateral ligament, or the fibular collateral ligament, which attaches from the lateral femoral condyle to the head of the fibula right here, and this resists varus forces throughout the knee. Okay, so now we're looking at the posterior view of the knee, and you can see the ACL and the PCL, which are labeled, and the ACL runs from the anterior aspect of the tibia, passes superiorly and forward to attach to the inside of the medial femoral condyle, right here. And then we have the PCL, which attaches from the posterior aspect of the tibia, passes superior and forward to attach to the inside of the medial femoral condyle. And this resists anterior displacement of the tibia, and the ACL prevents posterior displacement of the tibia. And then here you can also see the lateral meniscus and the medial meniscus, and this is the ACL, and the PCL is back here.